Gallions Reach Dental Clinic treats more than 4,500 patients each year who are referred by their dentists for all aspects of minor oral surgery, including surgical extractions, third molar removal, apical surgery and comprehensive dental implant treatment.
We accept patients on referral from general dental practitioners, so for virtually all patients are sent to us by a dentist rather than contacting us direct for treatment. In doing this, we're specifically undertaking oral surgery or implant work on request from that practitioner. If we need to do any variation in the treatment plan or we think there are some other issues that need consideration, we liaise closely with the referring practitioner and communicate with them about the treatment that we think is appropriate to carry out. All patients have a consultation in advance of the treatment being carried out. We'll verify the treatment being carried out. If we've got any queries, we'll of course contact the practitioner. And the pathway for the patient is such that the person undertaking the consultation here at the clinic is almost always going to be the same person who carries out the actual surgery. And a small team of dedicated surgeons and anaesthetists will carry out this minor oral surgery or implant work, and most importantly, on completion, we'll send them back to their own dental surgeon with a written summary of the treatment carried out.
We try to work with our local dentists to provide the services that they require. Primarily our service is oral surgery, but if there are other treatments that are required, then we will liaise closely with the referring dentist.
More than 300 dentists from across South London and North and West Kent now refer both fee-paying independent and NHS patients to Gallions Reach, which provides a team of dedicated oral surgeons, dental surgeons, anaesthetists and nurses.
Gallions Reach have always provided a really excellent and efficient service for the extraction of any teeth that we might need removing, or indeed for any minor oral surgery that might need to be done. And they're very efficient, they're very good and extremely reliable, and in fact their service is so good that I think we're very fortunate to have it in this area, because it's an unusual thing to have such an efficient service as theirs.
Once a patient is referred for oral surgery or dental implants, they attend an initial assessment where the options for treatment are explored. A written plan is then produced and, where appropriate, discussed with the patient's dentist.
The implant referred patients will go back to their dentists for future treatments and maintenance and monitoring. We here are on first name basis with the referring dentist, so any problems, rather than having to phone up and us being an unknown face to them, we're totally approachable. Mobile phones, normal phones, email, we'll get back to them straight away, and that's the way we like to be. We like to be very approachable to people.
For those dentists wishing to carry out the restorative aspects of dental implant treatment, there is a very close liaison about the treatment plan.
I feel very involved with the treatment process. I formed a very good relationship with several of the dentists here, and if I ever have any concerns, they're always more than happy to answer those for me over the phone or in person.
They do the treatment under sedation, which is something I can't offer myself, but also it seems to be like a really caring atmosphere down here, and the quality of the work is always very good when the patients come back.
Once the implant treatment plan is accepted, there is a full diagnostic workup, including study models and photographs, together with a working template. Whilst the implant surgery is specialised, many of the restorative aspects of treatment can be undertaken by the patient's own dentist with appropriate training.
I think it's important because the dentist is in charge of their overall care, and if their dentist can do the restorative aspects of the treatment, they feel involved and the patient's happy with being treated where they normally are treated anyway. So I think overall that helps them with their treatment.
We have to consider a team approach because the referring dentist quite often has a closer relationship with the referred patient, and we can't treat that patient in isolation.
Gallions Reach also provides a free study club for referring dentists, teaching how to manage the restoration of simple implant cases such as crowns, small bridges and simple overdentures, and provides training in the basic techniques required for this restoration work. More information about the study club is available in a separate video.
The staff are very friendly and it's very quick service. Treatment's always very good and they come round quickly from the sedation. Yeah, all very positive.
I would definitely recommend Gallions. I've had experience with them in terms of implants and children requiring sedation under the age of 18 and several complicated extractions. And with all of those cases, I can confidently say that they provided a great service.
They're very good at what they do. They're very experienced and very slick at what they do, because they do a lot of it. And so they provide an excellent service.